Hi, today I'll be showing you how to perform a bed shampoo. When you say bed shampoo, you are shampooing a patient's hair on bed. The reason is because your patient is very ill and the patient cannot go to the bathroom to take a bath or to bath the hair or do a hair shampoo. So, in preparation, first, you need to introduce yourself. Of course, if I have a patient, I need to introduce myself. Then I have to explain the procedure that I will be doing, and I have to provide patient's privacy by closing the windows or closing the doors or closing the curtains. And then you have to assess your client. So you have to determine routine, what is your patient's routinely used shampoo, and if your patient has any allergies to certain products. You have to assess the scalp of your patient, check for any abnormalities in the scalp, maybe there is dandruff or anything, and also assess the activity tolerance of your patient. And then be sure to determine whether the patient needs assistance during the bath, and of course you have to determine whether there is really an order for the patient to have a bed shampoo, and if there are certain products that is preferred by the physician, which is maybe because there are some allergies, so the physician or the care provider ordered a certain product that will be used for the shampoo. And of course, the best time of the day, that if there is an indicated time wherein you should perform the bed shampoo for the patient. You need to assemble all your equipments needed before starting your procedure. So be sure you have, of course, you have your comb or brush. Of course, you need your shampoo. So I have here a container wherein I will mix the shampoo that will be used for the patient. And then I have here, this is the wait sir,
check it out.
and you have your shampoo basin. You will see this is the one you will put in the patient's head so that it will receive the water that you used in rinsing the patient's hair. Of course, you may need a gloves if there is a need to protect yourself, and then you need a towel, small towels or face towels. Of course, you need this is your washcloth, of course, and then you have your this is a protective covering or an absorbent pad. You need 2 towels that you will be using, and then you have a pitcher of water, and of course maybe this is not enough, so you need extra water. And then you need a container to receive the water that you will be using for rinsing. It can be a pail or any container. So I have now the equipments ready. We are now ready to perform a bed shampoo. My patient today is Sir Toboso, and of course you need to introduce yourself. Hi, Mr. Toboso. You are Mr. Toboso, right, sir?
Yes,
okay. So I will perform a hair shampoo for you so that your hair will look fresh and good. Is it just okay, sir?
Yes.
Okay. So you need your patient to be positioned properly on one side of the bed so that it will be easier for you to reach the head of your patient. So if your patient is able to slide the body, you can just assist your patient to move. Sir, can we move a little to this side? Okay. Thank you, sir. Now, if you are performing a bed shampoo to a female client, you need to remove the pins or the ribbons if there are any. And usually ladies has long hair, sometimes it's curly. So you need to detangle or remove the tangles first. So you need to comb your patient's hair to remove the tangles, so that when you shampoo, you easily can shampoo. Okay. And then you put a rubber sheet under your patient's head, and you need to adjust the pillow. You adjust the pillow towards the patient's shoulder. Sir, I will adjust your pillow. It should be, can a little more, sir. Okay. So it should be on the shoulder of your patient, and then you put a protective sheet or your rubber sheet. So, sorry, sir. Okay. Put your shampoo basin, assist your client. Okay. So you should have, this one should be supporting here so that your patient's neck will not hurt. Is it okay, sir? That one? Okay. Adjust. Okay. Are you comfortable with that position, sir? Now, this is optional. You can put cotton balls to plug the ears of your patient so that it will be protected from water. And towel under your patient's shoulder. Bring it here. This will serve also as your protection for the patient, and this will be used in drying your patient's hair. Now make sure that this part, okay, make sure that the water will drain on your receiving pail, and then you can protect the eyes of your patient by covering it with a folded face towel. Now you are ready to wet your patient's hair. So pour a little amount of water, just enough to wet your patient's hair. Be sure your ladle or your pitcher will not touch your patient's hair. Okay, after you wet, okay, get your shampoo. I pre-mixed it already in a container, so that the shampoo will not be directly applied on the patient's hair. And then pour a little amount of your shampoo. And then lather. Massage the scalp using the fat pads of your fingers. This is your fat pads. So, circular motion. Okay, you can support the head with your one hand, and the other hand can massage, and then turn a little to the side so that you can work on the other side of the head. Okay, then milk the excess shampoo, and then rinse, partly rinse, then apply another shampoo for the second time. Okay, this time massage again and make a rich lather. Be sure to massage all parts of the head, and you have cleaned all the hair without leaving any part not clean. Okay, you can support and turn to one side and then milk the hair like that. Okay, get your pitcher of water. Okay, pour and rinse properly. You should pour from the forehead down and follow with your hand, avoiding the water to enter the patient's ears. So we need more water because there is still soap. Be sure to rinse your patient's hair properly, or else if this is not properly rinsed, then the patient might have some allergies on the scalp, or the patient will have maybe some dandruffs because of not properly rinsing your patient's hair. So you have to clean even under the head. Okay, so I think I have this. Okay, so milk, sorry, my hand has shampoo. Okay, so we have this properly. So milk excess water. Okay, support the head with one hand and remove this shampoo board. Okay, sir. Okay, so spread your towel. So my patient already removed the face towel. You can remove the plug on the ears. Nalaglag na siya. Wala na. Okay. And then get this one and dry. Okay, we will now dry our patient's hair. Okay, now you can adjust the pillow. Okay, so my patient's hair is dry. So I will not remove first the protective sheet because my patient's hair is still wet, or sometimes you leave the towel there until your patient's hair is properly dried, or sometimes your linen will be soiled, so you need to do changing of your linens. And now you comb your patient's hair. Okay, so after you have performed your bed shampoo, you can put back your patient's top sheet. remove this one. Okay, so be sure you have you clean all the equipments used, you return to its proper places, your patient is comfortable on bed, and then you have to do hand hygiene. Of course, do not forget that. So if there is a faucet, maybe better if you will do hand washing. And then of course, do not forget to, you have to document your procedure.